thanks for organising this fantastic conference. Thanks to Ruth for all her hard work, and thanks to you lot for staying till the bitter end. I really, really appreciate it. So a bit of a fast canter through nursing. There are my interests. There aren't many of them. Oh, no, we seem to have jammed now. Right, so what I'm going to cover a bit of a context about nursing. Why is it relevant to this discussion about evidence-based healthcare? A look at some of the good things that nursing's achieved and some of the not so good things that we're grappling with, and some suggestions for how we might do things better. Apologies, this is a very English perspective. Really from a point of frustration, I think in the UK and in England, we used to be good at this stuff. We used to be good at nursing research. I don't think we're so good now. What can we do to fix that? So, why is this important? Well, nursing is a huge professional workforce. It's the largest in the NHS. It delivers most of the hands-on care. There's over 1,250,000 of us and 25,000 midwives just in England. And nowadays, only for the last 3 years, you have to do a degree to be a nurse in the UK. Now, that's been the case in lots of parts of the world for a long time. We're newbies to that. And that degree study, and you might wonder why I'm even mentioning it, is a lot of work. It's 4,600 hours we are told we have to deliver of teaching. That's a lot of teaching compared with most undergraduates, and half of that is theory and half of that is out in practice. And a very small proportion of nurses have higher degrees. There's a timeline. I'm not going to talk through it in any detail here, but just to emphasise how recent academic endeavour has come to nursing, or how recently nurses have come to academic endeavour. So, yeah, Florence Nightingale was probably the world's first clinical epidemiologist back in the 1800s. But the first trial in a nursing journal was only published in 1972, the same year that the Briggs report demanded that nursing became a research-based profession. And it is far from achieved that even now. It's a long way off. So we've come quite a long way in a short time, but there's much further to go. Why does it matter? What do nurses do? What kind of decisions do they make? We did a big study in the early 2000s, looked at 400 hours of nursing behaviour in the community and the hospital settings. We did 200 in-depth interviews with all kinds of different sorts of nurses. Part of one of the aims of that was to really try and nail down what kinds of decisions nurses are making, as well as what resources they're using to make those decisions. Were they using any research evidence? And what was fascinating to us, and nobody had really looked at it before then, was that by and large, in fact by far, the most frequent type of decision that nurses were making was concerning choosing interventions to deliver to patients, including whom to deliver them to and when should they be delivered, but also which interventions. Needing trial evidence to make good decisions. But also decisions about referral to whom and when, what to communicate and how to communicate it, and to whom should it be communicated. Quite a bit about service delivery and organisation, but mainly about choosing interventions. So that's a bit of context to nursing and what nurses do here. Some of the good things that nursing's achieved and the evidence-based nursing's achieved, I think. Well, we have been obsessed with implementing evidence into practice since before we had any evidence to implement. So back in 1977, Nancy Roper, who was a guru of nursing, said we do far too much based on tradition, not enough on research. Somebody else said, it's already become a cliche that nursing should have become a research-based profession. That was in 1981. And another good thing is that evidence-based practice is enshrined in our professional standards in the UK. So we have this thing called the Nursing and Midwifery Council, which is our regulator. And in their competencies, they say nurses should use up-to-date knowledge and evidence. They must make person-centred, evidence-based judgments and decisions. We should be teaching students research methods and use of evidence. I'll return to that. And we should always practice in line with the best available evidence and make sure that any information or advice given is evidence-based. Now, those words are really easy to say, aren't they? And also, loads of policy documents keep coming out. One only a few months ago from Health Education England, which runs health professional education in England, said in its vision for the future, the ability to research, engage in critical inquiry and implement is imperative. So we try and teach that. At Manchester, this is a bit of our curriculum, a thin slice through our 3-year curriculum, epidemiology and public health in the first year, nursing knowledge and research, and so on, trying to imbue in these students a sense of what does good evidence look like, how do you match it to decisions. So that's a potentially good thing. I'll tear some of this apart in a minute. And another good thing is nurses have always been obsessed with patient perspectives and experiences. So the paper on your left, which you can't read, is a paper from the first ever edition of the first ever nursing research journal. Really concerned about how people with long-term conditions adjust to home care. That's a paper back in the 1970s. And spooling forward to now, if I search PubMed for papers with the lived experience in the title, I find 671 articles, 64% of which are in the nursing journal core data set. Nurses are very concerned about researching how it feels to be a patient, what it's like from the patient perspective. Another great piece of news, and this is my favourite slide of all actually, so these are the most downloaded Cochrane reviews of the most recent year for which we have data, and that's 2014. They're the top 10 most frequently downloaded reviews. All of them, except possibly that one, relate to core nursing and midwifery activities. Now, by and large, it's not doctors downloading these Cochrane reviews. These are mainly nurses, midwives and therapists finding out about how to stop older people falling, about skin-to-skin contact for babies, about discharge planning from hospital to home. This tells me that nursing, midwifery and the allied health professions are hungry for good evidence. Can we deliver it to them? Well, another good thing that's happened is that the National Institute for Health Research in the UK, which is 10 years old this year, has, I think, transformed the landscape of funding for nursing and midwifery and AHP research here. Lots of training for research capacity development, lots of PhDs now and graduates. They've also funded masses of evidence synthesis on core topics like wound care, which is my area. Early funding of systematic reviews helped pump prime the Cochrane Wounds Group. The NIHR is the largest independent funder of wounds research in the world. Most wounds research is funded by the industry. And then they have put their money where the gaps are and funded trials to fill the evidence gaps in wound care and in many other nursing, midwifery and allied health professional areas. But each of these trials that cost a lot of money are just a tiny increment of knowledge in the vast desert that is the practice of our professions. So what's not so good? Well, those 4,600 hours of teaching that we have to do, actually, I suppose one upside of Brexit, I found an upside of Brexit, that's brilliant, is that these 4,600 hours, which are stipulated, are EU regulated. So we might actually be freed up to teach a bit less and develop people a bit more and help them develop themselves a bit more. That would be brilliant. So there is an upside. So loads of teaching hours, massive student cohorts, and actually what's happened in the UK for quite a while is the cost of training nurses, midwives, has not been covered by the fees that we get from government to train them. So it's been done at a loss and no research time. So where do we make the research evidence? Very hard. We've got a shortage of leaders. There are only 260 nursing midwifery professors in the UK, a very tiny percentage of the workforce, very few research leaders. How are we bringing on the next generation of nurse, midwife, AHP investigators? Very hard. Very few clinical academic posts. There's no clinical academic career structure in this country for our professions. So it's very hard to find people who can practice and do research and teach. Things that medicine's taken for granted for decades. That's a problem because then academics are not visible to practicing nurses and midwives and AHPs. They don't see our profession, our research side of the profession, as something that is makes a difference, is something to aspire to, or is something that's worthwhile. It's largely invisible. And then we have the problem of the public perception of nursing. I think midwives have this problem less, but nurses have it. So the lovely Nigella Lawson, whose recipes I adore, published this article in the Times a few years ago, really thought it was a total waste of time to try and teach these nurses anything academic at all. That's not what nursing was about. Bear in mind, though, that in the UK, nurses can prescribe any drug. So you do need quite a bit of education to be able to do that. Then we've got confusing messages from our leaders to grapple with, and this is a document that was released only last month from NHS England, the 10 commitments about nursing from the chief nurse. Commitment 7, we will lead and drive research to evidence the impact of what we do. Isn't that the wrong way around? Shouldn't we be doing research that informs what we do in order to make sure what we do is effective and efficient, not searching around for evidence to show that what we're already doing is effective and efficient? Very confused. So we've got the wrong people teaching the wrong things. Most of nurses get taught how to do research, not how to use it. That's different, by people who've never done any. Few of us have been taught how to find and use appropriate research in decision making. That is the skill set that most health professionals need, not doing research. And coming back to Anthony's point, the emphasis in nursing and midwifery has been on qualitative research. For decades, that's important. It's not sufficient. We do much more qualitative than quantitative because that's reflecting the comfort zones of the people who are teaching us who themselves haven't done research. There are pockets of excellent evidence-based practice in nursing and midwifery, but mainly in specialties. It's not mainstream. And there is no evidence resource. I think this is probably true for medicine too. No evidence resource that's fit for purpose, really, and freely available that you can use on the fly and look things up for practice quickly. So, coming towards the end, my big dreams. Well, first of all, we need to value our professions in a way that that we acknowledge they make a real difference to health outcomes, that can then attract in the brightest, the compassionate people who have the ability to think, care and communicate simultaneously, and make this an attractive profession to be part of. And then we need nursing leaders who understand research and understand how evidence can be used and understand that and can show the difference that evidence makes. And we need policies that support clinical academic careers and make them visible. So the nuts and bolts of that, I think we urgently need to skill people up with clinical epidemiology for teaching and research. Hardly anybody has these skills. We need to create the space for us to do research, and we need an evidence resource that's fit for purpose, including, as a basic thing, IT support for community nurses. Most nurses work out in the community delivering care to people where they live, and everything's done on scraps of paper. And the communication is poor, there is no decision support, there's no good record keeping. And we need to ensure that qualifying nurses and midwives are skilled up to be able to manage change, to implement research, and need to develop a massive personal resistance, because once you get out there, it's very, very hard to change the hearts and minds of staff who qualified a long time before. Thank you.